To have a behavioral health program is extremely valuable to patients and to families because, as you can imagine, having anxiety and depression and also having diabetes can impact their lives significantly. Patients and families that are experiencing a diagnosis of diabetes experienced higher levels of anxiety and depression, and leadership recognized a need for behavioral health management. When they come for the routine visit at the practice, they're routinely assessed for anxiety and depression, and if they have a positive screener for anxiety or depression, we'll explore a little further, and it may be a simple encouragement to their current mental health provider, or they'll utilize one of the licensed clinical social workers that we have at the Wendy Novak Diabetes Center. If we do see a need that we can meet on a consistent basis to provide mental health therapy to them, which again helps kind of negate maybe some symptoms or experience of diabetes distress or diabetes burnout. Diabetes burnout is something that people experience when they're done having diabetes. They don't want to deal with it every day because it is a chronic condition. They deal with it, as you can imagine, blood sugar checks, insulin, everything. It can be overwhelming when you've done it for a long time, and we have a lot of patients in the clinic that have been diagnosed at sometimes even 2 years of age. So they've been dealing with this every day, and they get to a point specifically, usually around the time early adolescence and adolescence, where they're done with it. They'll tell you, I don't want to have it anymore. I'm over it. And obviously that's not an option. Having a mental health professional that's trained in this can go in and talk to them and understand where they're coming from and give them some simple tweaks that may be helpful. We have specialized education and specialized experience that allows us to support families in this role. I myself have 8 years experience in working with kids who have medically complex issues and understand how it affects not only the patient but also the family system as a whole.
The Wendy Novak Diabetes Center is part of Norton Children's Endocrinology, affiliated with the U of L School of Medicine. We focus on caring for and educating families touched by diabetes so they can live healthy and active lives. As we strive for a world without diabetes, we ask that you help by donating today at nortonchildrens.com/diabetes.